Hello, everyone, and welcome to Preventative Health Awareness Movement and this special broadcast. I'm Margaret Wallis-Duffy, the founder of Wallis for Wellness and Preventative Health Awareness Month, which takes place every February, and movement. And I'm incredibly proud to say that it's recognized by Health Canada. Now, this grassroots initiative that started 3 short years ago is picking up tremendous momentum with healthcare professionals from many disciplines believing in the mission of breaking down the silos, working better together with one mission in mind. And that is to help educate and empower the everyday person, you, to get into the driver's seat and become the CEO of your health, focusing on prevention instead of just a pill for an ill, wait till it's broken, which unfortunately is what our current healthcare system is struggling with at this time. Now, one of those incredible, as I like to refer to them, ambassadors is Dr. Kristy Prouse, who is an OBGYN. She's also a functional medicine doctor, the founder of the Institute for Hormonal Health. Dr. Prouse not only was my doctor and literally saved me. That's the best way to describe it. We're going to get into that in our conversation here in a moment. But over the course of more than a decade, I have had the absolute privilege and honor of working alongside her, education and media, learning from her, working better together to improve the health and well-being of the people we have the privilege of treating. And today, I'm so excited to have Dr. Prouse with us because we're about to talk about something unbelievably exciting, a full circle moment for me. Dr. Prouse, welcome.
Thank you so much. I'm excited to be part of this conversation, as always.
Yes, and you're looking gorgeous as ever. And I know that we're both beaming with excitement about what we're about to talk about. But before we do that, I think it'd be really good to put some framework around how we came together and why this project we're about to talk about means a great deal, certainly personally for me. So many of you that follow me have probably heard me speak out for the last 30 years that I've had a chronic disease that really hijacked my life and really was the foundation and reason why I started Wallis for Wellness more than 33 years ago, because I knew what it took for me to get the help that I needed. And so Wallis for Wellness after 30 years grew to where doctors and naturopaths and massage therapists and physios and were working together. But what I didn't talk about boldly until recently, I didn't name the disease that hijacked my life for more than a decade, because quite frankly, I was gaslighted for more than 10 years in my early days as a young teenager. This disease led to things like 10 surgeries, 4 bowel obstructions that required a nasogastric tube, a lung collapse. I went through menopause at the young age of 39, which is when I met this incredible physician who literally saved me. And it really has hijacked my life, and that disease is called endometriosis. Now, why haven't I not boldly spoke about it? Because it took 10 years for me to get a diagnosis, and I was called a hypersensitive only child, a drug-seeking teen, a competitive athlete with a nervous stomach, and oh, it's just a little bad period. Get over it. When you're told that for so long, you start to believe it. And when you go, it takes 10 years, and the stats in this country are staggering when it comes to endometriosis. And I'm going to talk to one of the best that would know about this, Dr. Prouse being an OBGYN. She saved me when I went through menopause at 39 because no one was listening. And endometriosis doesn't just impact your childbearing years and cause infertility, but it can actually impact your menopausal journey as well. Dr. Prouse, you saved me 10 years ago. We did a 3-part hormonal health series long before it was cool and sexy. And we're happy that it's happening now. And you love to say, thank goodness Holly Berry had a hot flash or this movement wouldn't be happening. But what has that been like to listen to me now boldly speak my story about endometriosis and the impact it can have for thousands of women?
I think endometriosis is the great masquerader. It isn't always very obvious as to what's going on for women. And so it can present in a whole bunch of different ways and isn't always obvious. But because it isn't always obvious to the practitioner and it doesn't always have outward manifestation that you can identify, a lot of women can really struggle. And it really, in many ways, puts some perspective even for me as a practitioner and looking at women. I get to see them at a moment in time, and it may not be at a really difficult moment in time. There are times where you will appear to be just fine, and yet that doesn't mean that it's not wreaking havoc. And it's not that I haven't listened to my patients over the years, but I think when you know somebody and you can hear their personal story, and I know that you are a tough cookie. And so to hear your angle and your perspective and to really appreciate the amount of struggle that some women can go through is heartbreaking, actually, in many ways.
It is. And this is a full circle moment for me because I went through this from the beginning of menarche when I had my first menstrual cycle, and excruciating pain, debilitating pain where you're missing work and missing school and not being heard. And my bowel had always been an issue. And like I said, I had a rare case of endometrial tissue on my lung that caused a lung collapse. But some women can have extensive disease and be asymptomatic, like you said, it breaks, right? And others can have extreme disease and extreme symptoms. I went through infertility treatments. I'm blessed to have 2 children because endometriosis wreaks havoc on fertility for many women. My kids are 6 years apart, and I'm blessed and grateful for that. But it doesn't just go away once you had babies. And that's what they told me. And really, it took me rolling up my sleeves. And that's why I opened Wallis for Wellness 33 years ago, because it took a whole team and an effort. Yes, I required surgery. I had to get what was an laparoscopic surgery, but interestingly enough, and you as a gynecological surgeon, you can speak to this better than I can. But the first surgery told me there was nothing wrong with me. When in
Yeah.
there was, my pelvis was full of it. It was on my bowel that caused fourbowel obstructions. Can you speak to that? Because there's going to be women, and the stats are staggering. I wrote a blog less than a month ago sharing my story, and I will certainly link it in the post when we share this video. Because the stats, it's millions of women. So let's talk about that. The fact from your perspective as a surgeon, when you're going in to try to look for something, not only can it present looking differently, different pigmentless lesions and various things, but also the disease itself and how widespread it can be.
Yeah. Yeah. And it may not be seen at all. And I think that's the biggest challenge, right? So endometriosis is basically endometrial tissue that is meant to be inside the uterus, ends up outside of the uterus, more often than not in the pelvis, but it can be on the bowel, it can be on the bladder, it can be, as in your situation, lung. You can have it really anywhere in your body. But the thing is, an endometriosis implant needs those cells need to multiply to 1,000 cells in order for it to be visible to the naked eye and therefore seen at surgery. So if you can't see it, you can't treat it. So in other words, you could have a pelvis full of endometriosis, but if an implant hasn't multiplied enough, you're not going to see anything. So you've had surgery to see nothing, which is the traditional way of making the diagnosis, and then being told that there's nothing there, which may actually not be the case. And yeah, it's a layer that fortunately with new technology, we are gaining insight in a different way, which is super exciting. Game changer.
And this literally, what we're about to talk about, literally stopped me in my tracks and brought me to tears when I was reading this, because my story is real. It's been hard. And it's 40 years later that women are still going through this, taking upwards. The stats are 7 to 10 years for a woman to get a diagnosis of endometriosis. And here, as the founder of Preventative Health Movement, and we know that when we can find things earlier and prevent them from progressing, maybe I wouldn't have had fourbowel obstructions that required nasal gastric tubes. Maybe it wouldn't have gone to my lung. Maybe I wouldn't have had the same infertility issues if this had been found at 13, if I'd been listened to, or like you said, it's sometimes not seen, if new technology, which now is actually happening, looks at this from a different lens. It is so validating for me. It's the reason I have been passionate in this preventative and integrative health space for more than 3 decades, but now full circle because, and drum roll please, Dr. Prouse and I, in collaboration, like the PHAM movement, in collaboration with Dr. Prouse and Endo Diagnosis, Inc., who are the distributors of a new Tier-1 diagnostic test for endometriosis. We are bringing it to Ontario for the first time ever. Now, hold on tight because listen to this. This is non-surgical, so it's non-invasive. It's 99% accuracy. It is literally like putting, like an ECG would look at your electrical activity of your heart. These leads look at the myoelectrical activity in your gut. And I'm going to have you speak to that in a moment, Dr. Prouse. You literally, in under an hour, can have a definitive diagnosis of whether you have endometriosis or you don't, the amount of the disease, so that you can get to work with your treatment plan, an integrative approach, and hopefully prevent. Actually getting tearful because this is how it just needs to be. Prevent millions of other women from going through what I did and my family did and my husband did for years. This test is a game changer. Dr. Prouse, why have you decided to partner with me as the most responsible physician? Because we're partnering together with the PHAM movement to bring this to Ontario from the Endo Road Show from August 11th to the 13th. And we'll talk about that in a minute. Why have you decided to partner with me on this?
I think first and foremost, this can have a huge impact for a lot of women and the management of them, and young women in particular. The whole fertility cohort of women that really struggle, even the pre-pregnancy and the association of endometriosis with complications of pregnancy, it's really far reaching with a technology that you already described as a tier-1 diagnostic. So that just basically means it's met all of the rigors. This isn't just a fly-by-night technology. It's really gone through the testing to prove that it can make a difference and a clinically relevant impact. That really excites me. As always, in our conversations, we always come back to the physiology of things and having a better understanding of endometriosis itself and the why behind it and why such a technology would work, I find absolutely fascinating. So for me, it's all about making an impact for the greatest number of people. And this is one way that we're always at that cutting edge. You want to get to understand a technology in the early phases of it when there's enough evidence to support it. And yet at a time also where you can impact and just make this available wherever. So that's basically why I'm excited, because it'll make a difference.
It sure will. It'll make a massive impact both for the patient experience, for their quality of life, but also for the impact on the healthcare system and the strain.
Right.
Mentioned people can have surgeries and that cost a lot of money and resources, but still be left with no answers.
Right.
This, in a very short order and under an hour, with very little cost and very little resources, you can get a diagnosis. Then, of course, working better together with the surgeon, with your gynecologist, with your integrative healthcare team. It might be your hormone specialist. It might be your exercise person, your nutrition. You can create a plan to move forward. Can you speak to actually what this test looks at in terms of the myoelectrical activity of the gut and why that's relevant to women with endometriosis, why it can be a definitive test with such accuracy?
Yeah. So basically, we know that endometriosis, the implants that are outside of the uterus, will give off to neurotransmitters called PGE2 and PGF alpha. And they give them out, they produce them in very large quantities. That gets absorbed into the bloodstream, circulated through into the enterohepatic circulatory system, which supplies the gut. And those compounds released at the gut level create dysfunction in the gut. And basically what that means is you've got your normal peristalsis, yes, but at the same time, you've got this abnormal spasmodic contractions working against it. And so you end up with this very irregular electrical pattern that is picked up by the small bowel and transmitted to electrodes on the stomach. So again, just as you gave the example of an EKG, we're all familiar with that for the most part. It's the same thing. We're picking up the electrical activity of the gut and the abnormal pattern that could be seen with endometriosis. And by the way, without any other disorders that mimic endometriosis showing up with that same pattern. So it's a very unique fingerprint to endometriosis and or adenomyosis, which are basically one and the same.
It's a game changer. And this is why when I was literally reading this recently, it literally ignited something deep in my soul for me to sit at my computer at 11 o'clock at night and write the blog about my endo story, because I'd never really claimed it the way I knew I could and should, because the timing was now when I knew that I could take my story for good on top of this preventative health movement, which is allowing us to reach more people. And now we're taking it across Ontario and hopefully across the country, and also going to lobby for this to be covered by extended health insurance, because this is not OHIP covered. But I will say this as an endo warrior, and that's the way I refer to myself, because it's not easy being a woman with endometriosis. Let me tell you, it's not for the faint of heart. This is debilitating, excruciating pain that you have to push through. And it impacts every aspect of your life and your health, your relationships, your sexuality, your sexual health, your ability to work, your ability to go to school. And so when I read this and I wrote this blog and then found out about this test, I knew I had to bring it to Canadians and then I knew the first person I had to reach out to was you. And as always, your integrity, your heart, your servant leadership, and your willingness to do the work to really help make a difference inspires me, Dr. Prouse. And so I'm really excited to announce that Grace Med hormonal health and functional medicine. Did I say that correctly?
Grace Med, functional medicine, and hormonal health. Yeah.
Well, this way. So medicine. My
Mouthful. Yeah.
Yes, it is indeed. They are going to be the first ever clinic in Ontario to offer this test to women on the day of August the 11th. And we couldn't be more excited. They're very excited about it. You're the chief medical officer. They're pretty excited to have this coming to their clinic, aren't they?
Yeah, absolutely. And of course, we've got an audience that this would very readily apply to. A lot of people that are struggling with hormonal issues, of course, no surprising, are dealing with endometriosis as well.
Yes. And then after on the 11th, then we're taking it on the road. The Endo Road Show is heading to Drip Barberry, Dr. Steve Rallis, and bringing it there. While we're on this road show, we're not just here to do these tests for women, but we're also here to educate physicians and practitioners and build awareness in the media about the availability of this test. We're going to want to talk to insurance companies about why they should look at covering this test, because it's going to save dollars, bottom line, but it's also going to make a massive impact on the health and well-being of people. And then I'm really proud and excited for a colleague and a friend, a registered massage therapist and the owner of Exeter Massage and Integrative Care, a rural community. She is one of our ambassadors that really champions the rural communities to get access to technologies, cutting edge therapies, because they often are left behind. The Greater Toronto Area gets a lot of this, but Little Exeter doesn't. But thanks to Stephanie Vandenbush and her team at Exeter Massage and Integrative Care, we're going to be there on August the 13th. And we already have somebody booked from Michigan driving to Exeter because she thought she was going to have to fly to the UK to get this test, because they've been rolling it out in the UK for quite some time. So we're already making an impact, and we haven't even left the gates. And that excites me. One thing we haven't talked about, which I think is really important to both of us, and I think to anybody listening, both patient and doctor alike, let's talk about the sound research and we can't talk about some that's going to be released, but what we know is sound and solid research backing this technology, Dr. Prouse.
Mm-hmm. Yeah, so the early studies were actually very well designed and well powered and reviewed, and basically compared 3 different cohorts and blinded the practitioners that were involved. And long and short of it is that the sensitivity, specificity, C statistic, which is a way of looking at how likely are you to actually have the disease if you've got a positive test, outstanding, really, from a statistical standpoint, very impressive. And so those were the baseline studies, but then of course you want the reproducibility of it. So there are 6 centers around the world that the data is rolling in from. It's all looking very promising. And I don't even want to say promising, because more than promising, it's quite impressive. And to have it reproduced and getting similar results from wherever, which is another sort of a finer detail. It doesn't matter where you are in the world. This test does not differentiate based on ethnicity, for example, obesity, thinness. The studies have been well designed that you are coming out with a pretty pure result.
And
so
also
pretty cool.
Yes. And also compared to the current laparoscopic diagnostic test
That's right. Using that as your gold standard. Yeah, no, it's again, game changing. Mm-hmm.
It really is. So on behalf of Dr. Prouse, myself, Endo Diagnosis, and the PHAM movement, we are beyond honored and proud to be the first to be bringing this to Canadians across Ontario. We're going to take this beyond. If you are a practitioner or a physician or have a clinic that you would like the Endo Road Show to come to you, this is what's so cool about this technology. It's portable, it's mobile, it's simple to use. We want to hear from you. If you are a woman suffering with endometriosis, or you think you do and you don't have the answers, or maybe you have a loved one that's been suffering for years and doesn't know where to turn, this also can help with your treatment plans, because you can have this on a regular basis and look to see if those therapeutics are working. That's something also that's just really good for the management of endometriosis, isn't it, Dr. Prouse?
Yeah, yeah, absolutely. Again, if you can avoid surgery, you avoid surgery. And yet that's not to say that's not a reasonable option for management, but it helps to gatekeep the management. And as well, it can be used as a tool to appreciate the impact that management has had, whether it be surgical or medical management.
Absolutely. And then from a prevented or sorry, an integrative lens, this isn't apart from women having those transvaginal ultrasounds or surgery. The wonderful thing about this is what I love about it most is it empowers the patient to get an answer and then to have a voice to push with their integrative healthcare team. So they're not gaslit and they're going to get the treatment they deserve sooner,
Right.
so they can prevent things from progressing. And to me, that is critically important. And as you said, this is going to be incredible for young women. And lastly, also menopausal women. Ladies, I just learned this. A person with endometriosis went through menopause at 39 and it wasn't easy. Thanks to Dr. Prouse and her brilliance and she changed my life. That being said, I have found out, because I was told, oh, once you have a baby, endo goes away. That is not true. And now we know that perhaps if you're struggling with the transition in life in menopause, maybe you have undiagnosed endometriosis that would be worth having a look at as well. Do you agree with that statement, Dr. Prouse?
Yeah, I think there's a constellation of symptoms that would certainly increase your index of suspicion for an underlying endometriosis. And yeah, it can be a helpful part for a subset of women for sure.
And without having to have surgery, which is what I love about it. It's something we can do and then have more information so we can make informed decisions. Well, Dr. Prouse, as always, not only are you always full, I learn from you every single time I speak to you and I'm with you, but I just feel blessed and honored to be linking arms with you as we bring this across the country. It's long overdue. And
Yeah, and the feeling is absolutely mutual as well. Thank you.
thank you so much. So if you're looking for more information about this test and about booking the road show, I'm going to make sure I put stuff in the post, but you can go to wallisforwellness.com or become the CEO of your health.com, and you can click on the booking link there. And I also put the booking link in the caption so that you can book there. You can reach out to Grace Med if you'd like to book your appointment. Dr. Prouse, where can they reach Grace Med in order to get their appointment booked?
Yep, they can go on the website, hormonalhealth.ca, and can send an email, can make a phone call. All the information is on that website.
Amazing. As we always say, better together as one, and a healthy tomorrow begins with prevention today. And that's what this Tier-1 test is about to do. So thank you, Dr. Prouse, for joining me. And we look forward to bringing you more great information as this PHAM movement continues to build across the country. Bye for now.